Hey everyone, it's Rena from the Health Bootcamps, and here we have Dr. Peter Osborne on the book masterclass for No Grain, No Pain. And today we're talking about chapter 2, which is Where Does It Hurt? Getting Started and Tracking Your Journey. Dr. Osborne, so tell us a little bit about the core essence of this chapter.
Well, we want to make sure that anybody starting our program has a subjective and an objective starting point, because you don't know where you're going if you don't know where you're starting from, right? So, if your pain levels are very high, if they're in your shoulders, in your knees, in your spine, if you've got other kinds of pain, we want to track that so that we have an initial starting point. So this gives the reader some information about where, to fill out. It's kind of like a form and a diagram, and they can track their pain, where it hurts, the intensity of their pain, the quality style of their pain, whether it's dull, achy, sharp, etc., so that they can track the changes over the 30-day program. So we're just trying to get a fundamental basis for where a person starts.
I'm curious, because you've had so many patients that you've helped, where do majority of the people experience pain?
So we actually classify pain in different ways. There's physical manifestations of pain, which can be muscles, joints, which is what most people think of, right? When they think of pain, they think, oh, my neck hurts, or oh, my back hurts. So there's the physical manifestation, so musculoskeletal pain or joint pain. But then there's also intestinal pain, gas, bloating, constipation, diarrhea, sharp stabbing, cramping pains. So we also want to make sure we're checking for those. Those are probably two of the most common. Now, there's a third type of pain as well. It's neurological pain, so radicular types of pain. Some people develop neurological numbness and tingling in their hands and their toes and their fingers. Some people have mysterious, sharp stabbing, shooting, deep pains in their bones. So we're just trying to classify. As far as commonality, probably in my office is known for musculoskeletal issues. So in my office, because that's what people come to see me for, we see a lot of musculoskeletal pain.
I have a dear friend, whose daughter is complaining of pain, which she says feels like it's in her bones. And again, no diagnosis, all the tests are clear. Have you come across something like that? How does it hurt in the bone?
It hurts in the bone. Well, this is actually a very, very common manifestation of chronic anemia. So what I mean by that is inside the bone is bone marrow. Right? And that's inside the bone marrow are what are called erythropoietic stem cells. They're stem cells that help generate red blood cells, white blood cells, and platelets. Okay. And so some people, when they're anemic means that they're not producing adequate blood elements. They're not producing either adequate red blood cells, white blood cells, or platelets. Most people think of anemia as an iron deficiency, right? But it's not just an iron deficiency. If your bone marrow is being overstimulated to try to produce more blood elements because you have a deficiency in those blood elements, that can actually trigger pain. We see people with chronic anemias. Iron deficiency anemia can do it, but folate deficiency anemia, vitamin B12 deficiency anemia, B6, zinc deficiency anemias can trigger those types of deeper pains. So that's one answer to that question. There are others, but that's a real common one.
Wow, that's really good to know. All right, well, we are going to be talking in our next chapter, chapter 3, pain caused by gray inflammation. So tune into that one next.